Welcome to this week's coronavirus task force meeting. This task force has met twice a week since the outbreak began. Last week, we began airing these conferences that we have twice a week live on Facebook so that the public could hear real time what the doctors and the medical professionals are advising to us. I have a sign language interpreter working with us during this telecast for some Hammond families that were having trouble understanding us. So we wanted to be able to communicate with everybody. I'd like to thank Brittany Gammon for helping us. We placed her window where people could see. That's why we had Dr. Frank log back in so that we could replace her window. So thank you very much, Brittany, for working with us. I'd like to remind everybody speaking that Brittany's trying to keep up with us when we talk. So if you could talk methodically and clearly so that she could keep up with us and we could communicate with every family in Hammond. So thank you guys for participating today. On this call, we have city leaders from civil government, including the Hammond City Council. We have School City Hammond represented. We have the Housing Authority represented. We have the Baptist Church represented, who runs a shelter in our city. We have other long-term care facilities on this call as well. I have police and fire located in here, public works, building, environmental. Just about everybody that could answer any questions we may have is here. And as we do every morning, every meeting, we're going to start with Dr. Frank Masana of Comprehensive Care, which is located on 169th Street, just over Klein Avenue, located in Gary. Dr. Frank, why don't you go ahead and give us our update, please?
Sure, good morning. So a couple things. CDC actually put out some revised guidelines over the weekend for return to work. I'm kind of reviewing them this morning. I'll make some changes, and Sharon, I'll get those over to you for the city. Essentially what they've done is they've extended the time frame from 7 days to 10 days, and now they have accounted for asymptomatic individuals that'll be in their own category as we evaluate them. Nothing super significant. I don't think it'll really change things very significantly as far as getting people back to work, but we need to be able to account for it. So I'll work on that and get that over to you. I actually am glad to see they accounted for the non-test or the asymptomatic individuals, since we know there's a lot of those who may have been tested positive. Now that we are getting more widespread testing and the contact tracing is allowing us to identify individuals who were in contact with confirmed positives, those individuals who are at high risk will be getting tested regardless of whether they're symptomatic. So this will be helpful. The contact tracing, I think, is getting some of the kinks worked out. I informed the Board of Health last Friday. There's an institution that has not been informing people of their positive results, which is not good. So I had concerns that that contact tracing will fall short if that doesn't take place. So they're working on that as well. I think as we move forward, some of these kinks will be getting worked out and we'll do a better job. Other than that, everything is pretty much at a status quo from where we were last Thursday.
Do you have any tests available at CompCare yet, or?
No. So yeah, it was yes, but not the nasopharyngeal. So I'm waiting for confirmation from LabCorp. Last week they started doing the antibody testing, which is a blood draw. They were not. It was not available. It's supposed to be available this week. I'm waiting to hear from them what day it'll be available to draw in the clinic. They were only doing it at their facilities, and you had to be a healthcare worker. So I did actually test it. I sent a healthcare worker over there and got them tested and got the results back within 24 hours. So once they open that up, we will be able to do testing at the clinic, but we will not be doing the nasopharyngeal swab testing. There's just a lot of issues with doing that and doing that correctly and getting it, transported where it needs to go.
Do you work out outside, Dr. Frank?
Do I work out?
Outside? Do you go like jogging or biking or anything like that during this?
Yes.
I'm just asking you a question just because there's a lot of people from the public watching this. When you're on your bike or when you're out in public, are you wearing a mask?
I do not wear a mask when I go jogging, but I keep very far away. If someone's coming, there's not a lot of cars, so you don't have to worry about going on the street as much. If I see someone coming in the other direction, or if I'm going to pass somebody, I do a big loop or I cross the street. And pretty much everybody that I come into contact is doing the same thing. I don't see very many people walking around with masks on if they're out and they're able to distance themselves, whether they're on bikes or with family. If I'm going to a store, I'm going to be indoors and I can't social distance, I absolutely do wear a mask. I was in Costco the other day, and I would venture to say 99% of the people in the store had masks on, and it was not a requirement to enter the store. Same thing with grocery stores. So I think the general public is understanding of the significance and is doing a good job for the most part. You're going to find those that don't, of course, but my experience has been that they have been following that.
So when you walk into the office in the morning, leaving your car to the office, you wear a mask into the office, and then when you get to your actual workplace, you take it off? Or I'm just wondering for public.
No, that's a good question. That's exactly what I do. We talked about last week, everybody in the clinic is required to wear masks. Anybody dealing with patient care. And when you're walking through the clinic, we do require that you wear a mask. So I do have one that I wear to and from my car. When I get up into the upstairs office where everybody is distanced, I take it off. There's nobody in my office.
Is it a surgical mask or is it N95?
I'm just simply wearing the surgical mask to and from my car. If I'm going into a store, I wear an N95 simply because I have access to it. But surgical mask is adequate. Truthfully, the N95s are a whole lot more uncomfortable. You got the straps on the back of your head. The surgical masks you can loop around your ear. They're a lot easier to wear. So just going in and out, I just wear that one.
Yeah, the N95 steams up my glasses too. I don't know how doctors do it.
They're a lot more restrictive of airflow, no doubt about it.
Okay. Thank you for right now. I'm probably going to come back to you again, okay? So, hi, Karen. Karen Callahan's the Director of ER Nursing at Franciscan Healthcare Center, Hammond. How you doing, Karen?
I'm good. How are you?
Good. Nice to meet you.
So just a couple things before I give you the numbers for the hospital. I feel that the community really needs to know that this is really an all-out effort. Everyone needs to play their part and wear the mask. When you talk about outside, the bike path over in through Hammond and Wicker Park especially over the weekend was extremely busy, and I saw probably 25% people wearing masks. I 100% agree with Dr. Masana about when you can social distance, but sometimes you're passing someone and say you have a jogger that's exhaling very hard. That would be someone that you want to stay away from. I mean, I'm just being honest, not, in a mean way, but that exhale breath is the person that you want to stay away from. So in the crowded bike paths, I would probably suggest to wear your mask. A couple of silly things, if you're making home masks, the CDC actually said that inside some of the women that are making them, there's a little pocket, and you can actually put a couple coffee filters. Obviously you can't wash them, but coffee filters have a little bit more of a barrier for the homemade masks. So those of you that sew, that's a good idea, is to put that coffee filter. For the hospital in Hammond, there's on Friday 23 admissions. So that number is trending down with 5 rule-outs. Year to date, discharged home from the ED and from inpatient, 163 patients with COVID, and deceased 35 patients. So just that information is out there that people do get well from this as long as they truly take care of themselves. The homeless shelter over the week or on Friday had some questions, and I just want to just put a shout out to, I think his name was Rick. I talked to him, and if he
He's
had
on
any,
the line right now. Yeah, Rick Sparks. He's on the line right now.
yes, and if he had any further questions, we talked about some things that he could do and how to isolate different people, that almost like a dirty area and a clean area. And if he had any other questions, he's more than welcome to call me. And I think that's all I have.
Thank you, Karen. Karen, let me ask you a couple questions too. So I just asked Dr. Frank a couple of the same questions I want to ask you, because I think it's interesting. I always feel when I get out of my car, I always feel like, why am I putting a mask on if I'm walking across a parking lot in the wide open outdoor? I can see putting it on when I get in my car. How do you do that when you're going to the grocery store? Do you put your mask on in your car, just walk in, shop, walk out, and then take your mask off?
So I have a little plastic Tupperware container that I put the strings of my mask on the outside, because what you don't want to touch, right, is the outside of the mask, because if someone coughs, that's where the germs are going to be. So I leave that in my car to kind of air it out. You can put it in like if people have one of those little small Starbucks bags with the like handles, they can hang the strings of the mask on the outside of the handles. And you can leave that in your car, because really when you're alone in your car, you don't need your mask on. You need your mask on when you're going into places.
Gotcha.
So the only other difference I was going to say about the crowded bike paths, just people need to be wary of someone exhaling, because that's where that's spread by droplets.
I hold my breath a lot on my bike.
Or turn your face away. You feel rude, right? Because you always smile. I always smile and say good morning, but now I'm like turning my face away. But it's not because I don't like you, but I don't want to have your exhale on my face.
If I look blue on a bike ride, I'm holding my breath. Okay. So I'm going to go ahead and hand off the mic to my Assistant Chief of Police, Andy Short, so that Andy can get us an update from the Hammond Police Department.
Hi, everybody. We're doing pretty well. Everything's steady. As far as the PPE, we probably got a month supply. We're doing very well as far as that. And as far as the crime, everything is very steady.
Yeah. So how about positives on the force? Anybody missing work right now?
Just one officer, and he came back negative, but two of his daughters tested positive, so he's off. So
we got one officer off, and not showing symptoms?
Not showing symptoms.
Good, just being cautious.
Yes, and using his own time.
Right. Okay, thanks, Andy.
Okay.
And by the way, Andy, so crime-wise right now, with the shelter in place, I mean, it's sort of a blessing for the police officers, right? I mean, yes, theoretically, yes. I imagine at 2 a.m, it's pretty quiet around here, right?
It's very quiet. I mean, it's surprising, but it's very quiet. And we still patrol in the parks area and make sure that it's not have everybody all over the place.
And I want to remind people that are watching right now that we're seeing kids go to the parks a lot. I saw it at MLK Park by City Hall the other day. I saw it in Hessville Park when I was driving by there, and the Hammond police officers are being forced to break these gatherings up, right?
Yes, I was out there Saturday, and I got them on my loudspeaker and told some guys to move along.
And they listen, obviously?
Yes.
Good. Okay. So thanks. I appreciate it, Chief. We're going to go to Deputy Chief Margraf from the Hammond Fire Department. How you doing, Chief?
Good morning, Mayor. Good morning, your listeners. We've had 75 calls for service over the weekend, which is generally normal for us. We've had no positive transports that we're aware of since we spoke last week on Thursday, which is a good thing. Mm-hmm. Our guys are doing well. We've got nobody off in regards to this. The one spouse of one of our employees has tested negative. So that's a positive for us as well. Our supplies, we're doing well, 1 to 2 months.
Good.
We just picked up a bunch of new gowns from Tradewinds in East Chicago today. We're awaiting 700 more masks that they make.
That's really nice. So thank you very much to the Tradewinds organization.
Absolutely. They've been helping not only us, but a lot of other organizations out as well. They can always use more help, by the way. Mm-hmm. We've given all of our personnel their own N95 mask. just over the past 3 days over the weekend, so they have their own.
How long does
For
that
now.
last for a fireman typically?
Well, I mean, it kind of depends on the atmosphere you're going to put yourself in. Obviously, you can sanitize them, you can clean those and utilize them again. It just depends if one's going to get saturated, possibly from somebody they come in contact with. It's probably going to be a one and done type thing. Again, the transports, we've had nothing confirmed since we spoke last week. And all in all, the fire department's doing well.
Thank you. Appreciate it.
Thank you.
I want to remind Hammond residents that as of yesterday, there's 316 positive cases in the city of Hammond. And unfortunately, we had one more fatality since we last spoke. So number of deaths in the city has gone up 1 to 11 fatalities of COVID-19 positive patients. And number of cases has gone up 41. No. Yeah, 40, yeah. 40 to 39, I apologize. Quick math. So they're out there. So be careful. 316 that we know about right now. Johnny, could you give us an update? You want to come over here?
Yes.
Yeah, we'll give you an update from Department of Public Works. Here, let's come right here, if you don't mind. I'll get away from you.
Good morning, Mayor. So far, the information that I got from Gary Gleason this morning, so far everything is okay. We're staying safe. We're cleaning up around the complex. He stated on PPE, we have 1 to 2 months supplies. So far we're doing good. You know, the people that get sick in our department, it could be the usual.
So you have 0 sick patients right now,
So far.
employees?
I
How
mean,
many sick employees have you had since the beginning of this?
Well, COVID-19 so far 0, but we didn't buy the flu because the allergy season, when it goes up, there will be a lot of people off. So far
Okay.
we're doing great, man.
So with the pickups, I know there's a lot of Hammond residents watching right now. We still only picking up what's inside the trash bin,
It's inside the trash bin.
and we're on time still on the normal day
We're
pickup.
still on time, and the mattress, we're wrapping them around plastic in order for us to pick that up.
And they have to call in
They
a
have to
mattress,
call in.
or if it's outside the garbage can, they have to call it in,
They
right?
have to call it in. A lot of times when they call, we ask, when they have mattress out there in the alley, we ask if they're already wrapped in plastic. If they're not, we let them know, give us a call back when you get it wrapped in plastic so we can take everything with us.
Okay. All right.
Okay?
Thanks,
you.
Johnny. I want to remind everybody I want to go back to our medical experts in a second here. I want to remind everybody where we are. There was some confusion regarding the governor's order. We're currently in stage 1. Stage 1 until next Monday. Stage 1 is city government shut down like it is. Schools are shut. Universities are closed. Basically, there's no gathering in public of larger than 10, if I remember correctly, currently. Social distancing enforced. Masks in public recommended, but not required legally, but definitely recommended. Restaurants are no dining in, no bar service, obviously, takeout only. Stores have social distancing requirements. That's stage 1, where we are now. Now, next Monday in Lake County, we come out of stage 1 and go to stage 2. Currently, Porter County and LaPorte County, also part of Northwest Indiana, they're in stage 2 now, today. So I know it's a little confusing, so I want to explain what stage 2 is. So Porter County and LaPorte County are going through stage 2 now, which is up to 25 people gatherings are allowed in stage 2. I'll go slow so Brittany can keep up. State government and local government offices opened for limited interaction. So when we go through this in Lake County, all of our employees will be in City Hall. However, if you need to interact with the building department, you can make an appointment, or you can, is that how it's going to work, Kelly? Make an appointment with the building department, or you'll have to talk to the guard and see if something could be worked out. If there's people too crowded, you'll have to wait outside during that phase. Industrial and other manufacturing retail, and commercial will open at 50% in stage 2. So things like liquor stores, jewelry stores, clothing stores, 50% will be open at 50% capacity. Shopping malls, 50% in stage 2, which isn't until next week in Lake County, 1 week from today, which is May 11th. Restaurants and bars, 50% capacity on 5/18. This is going to be on May 18th for restaurants and bars. Thank you for pointing that out. Hair salons, barber shops, nail salons, tattoo parlors, 5/18, May 18th. It's 2 weeks from today. By state order. We don't even have a choice on that locally. We could be more restrictive, but we can't be more liberal. So by law, under the executive order issued by the governor of the state of Indiana, restaurants, hair salons, or restaurants at 50%, hair salons, barber shops, nail salons, tattoo parlors, May 18th, by law in Lake County. Now in Porter County and LaPorte County, restaurants and all that, hair salons, barber shops, nail salons will open next Monday in Porter County. Church services begin next weekend in Lake County. May 8th, church services free up. And churches can begin their services next weekend with social distancing guidelines recommended. And also, if you're 65 and older, you're asked to stay at home. But church services across the state of Indiana will begin next weekend in accordance with this order. And in Hammond, we are following the governor's order to the letter of the law so far. If we feel like we need to go more conservative, we'll inform you through this channel like we're doing now. But in Hammond, we're following the governor's order, which means the soonest that you'll be able to go to Shoop's restaurant and eat would be 2 weeks from today. That's the soonest. The soonest you can get a haircut in Lake County, 2 weeks from today. The soonest. The only change we'll notice next week is the gathering number will go up from 10 to 25. City Hall employees will be back to work, but the schools are still going to be shut down. The universities are still going to be shut down. The parks are still going to be shut down. The casino is going to be shut down till mid-June. So I'm in right now, stage 3, which would be the next step up, is set to begin May 24th. And we're assuming in stage 3 that things are going well. What happens in stage 3 is social gatherings move up from 25 to 100 people. Movie theaters will begin to open up at half capacity. And we could start opening playgrounds in stage 3. Not until stage 3 though. So water park, splash pads, skateboard park, soccer field, basketball courts, playground equipment, frisbee golf, shut down until May 24th at the soonest. Going back to something that the Assistant Chief of Police said, if your kids are playing at the skateboard park, they're breaking the law. If your kids are going underneath our tape and swinging on the swings in the park, they are, I see it. They're breaking the law. At a certain point, we're going to stop being nice and stop recommending, and we're going to have to start doing something. So parents, if you're watching this, we need your help. We have School City in operation. I know we're on here. Catherine's on here. I'm going to come to her in a second. Kids are getting homework right now. Kids are going to class online right now. If your kid is not getting homework and your kid is not in class right now, they're not being truthful with you. So I'm going to go to Catherine so she can give us an update from the School City Hammond. Hi, Catherine. How you doing?
Good morning, everyone. Yes, teachers are still posting on Mondays
And they expect kids to be working and are available for meetings and consultations Monday, Wednesday, and Fridays. The last day for posting assignments will be Monday, May 18th. And then students will have the week of the 18th and the whole next week of the 25th to get everything done and wrapped up for the school year. So today's assignments are posted for, or this week's assignments were posted this morning for this week. Next Monday, you'll get more assignments. The 18th will be the last for the school year. So once your kids finish all their work the week of the 18th, their school year is over and they have finished everything.
Hey, Catherine, can I ask you a question? You know, when my son left school, it was shortly before spring break, and he didn't know that was the last time he was going to be in school. So his
Right.
desk is filled.
Right.
He's got. How are we dealing with this issue with the school city?
Right. So each school has a plan that they'll be communicating to the parents about when students will be allowed to come and pick up belongings. Generally for elementary schools, the teachers will be bagging up all the belongings and we'll have some kind of drive-through system where the parents get the bags. High school's a little different. Kids need to clean out lockers. So they're working on those schedules now. They have to make sure to keep the numbers in the building low. So it's going to be fairly spread out so kids don't start congregating in the hallways and in the school, and we can keep everyone safe and healthy. But parents will be getting that information. We're working on all that now.
Okay.
Also, the last update is just it's Teacher Appreciation Week this week. So if you can reach out to your kids' teachers and give them a thank you or a shout out on social media, I'm sure they'd really appreciate that.
Thank you. I appreciate it. Thank you, Catherine. Kat, one more question. We're right now, the rest of the school year is canceled, right? In School City, Hammond?
So in the state of Indiana, all buildings are closed until June 30th for right now. No workouts in the room, no spring training, no summer training, nothing till after June 30th. And the governor said we'll find out more in June about the fall.
I've heard a couple governors, and I haven't heard this from our governor, but I heard a couple governors talking about obviously in other states, saying that kids need to be so flexible that this summer, because of an anticipated second wave that could hit in the fall, that kids may actually go back to school in like July and August, anticipating they may be out in the fall if a second wave hits. Has there been any thought to that in the school city?
Yeah, we're looking at every scenario you can think of that could happen. And also we're looking at our CARES Act money, the extra funding that's coming to us to help support anything like that may happen.
Okay. Thank you very much. Thanks for being part of this, by the way. I know Superintendent Miller, it's nice to see you on here. I know a lot of people appreciate it. So thank you.
Thank you.
We're going to show a video that takes 10 seconds, and then I'm going to go to Karen Callahan next. So if you guys can watch this video, it's of a person sneezing with a mask on. All right. That's pretty nasty. Let's go to Karen Callahan. Karen, thank you for supplying that video to us. That was from the hospital.
So the reason I sent that to the public is because it is what we do now. When you talk about those openings in June, July, August, September, what we do now is our practice now is really going to be for the next year, right? Until spring of next year when flu season is over. So Hammond really has to wrap their heads around wearing masks and washing hands, because the outcome of the fall will depend on what we do now. So I cannot stress that enough, is wearing a mask is the new normal, right? Not wearing a mask, people kind of look at you like, why aren't you wearing a mask? So don't be afraid, don't feel embarrassed. Masking is part of the new normal right now when you're in public. And that video I thought was so powerful to show how a sneeze is spread, or a strong exhale or cough is spread. So that's why I shared it.
Thank you. We appreciate it. Do you have anything else you want to add before the call wraps up, Karen? I mean, I can tell you from my chair, going around the city of Hammond, after we had the press conference on Friday when the governor announced that we're going to begin rolling out of this shelter in place, I think that the general public thinks that we're free now. And I see people out, going to the parks and doing things they weren't doing. Are you seeing the same thing? Are you worried about this?
So my husband and I live in Hammond. We drove to Home Depot like the beginning, right when it opened, thinking it would be empty. The parking lot was full. We didn't even go in because, I'm hyper paranoid about germs now. So we turned around and came home. So I agree with you. I think people have this perception that it's going to be fine, and the governor's saying it's okay. But correct me if I'm wrong, we only go into stage 2 if we do good in stage 1. Is that correct?
I don't think that's true, Karen. I think that we automatically go into stage 2 in 1 week.
Okay. So I was kind of hoping that we would maybe reassess after a week, but because
I guess technically in Hammond, I could be more restrictive. Technically in Hammond, we could be more restrictive, but this is the blueprint given to us by the governor. We can't be more lax, but we could be tighter locally.
Okay. Well, maybe Thursday, if I report numbers went up, maybe I'm just saying, but
that would make a difference to me.
So no, I don't have anything else. Just please, just heed those directions. They're there for a reason.
Okay, thank you, Karen.
Thank you.
Go back to Dr. Frank Lasana. Hey, Dr. Frank.
Yep.
Karen brought a video. What'd you bring?
She outdid me. I can't compete. No, it was a very good video.
You have anything you want to add before we wrap up this call?
Yeah, the only thing I would add is I think all of those things are important. I just want to caution one thing. I am absolutely supportive and completely agree that while we open up, we need to do it in a safe manner. We really need, though, to not look only at the new cases, because we're going to see more cases because we're doing a better job of testing. What we also really need to keep in mind, and I've seen some of the governors point this out, and I think it's worth mentioning, is the hospitalized patients, the ICU capacity, the ventilator capacity, because that's why we did this in the first place, was not to overwhelm the healthcare system. So those are being factored into these decisions. So if we just focus on the positive cases, there's going to be a lot more. So it's important, though I don't want to minimize it, but we have to look at all of the good we've done to not overwhelm the healthcare system. As long as we're not doing that, I personally am supportive of opening in a responsible manner.
I was listening to a podcast yesterday that described a scenario in America where we go through the process we're going through, that we may as well get used to this, because we're going to have, until we come up with a vaccine, what they're saying in this podcast is we're going to be going through periods of time when we're all forced to lock down, and then when things start to clear up, we all get to go back out to work again, and if things flare up, we all have to lock down again. Is that something you think is possible, Dr. Frank? That we may be doing a shelter in place more than once, more than twice?
It's certainly possible. I think, though, you touched on it, what you're seeing out in public. I think the majority of people want to get back to some semblance of normal and are concerned for their own well-being, as well as other people's, and are following the rules. And if we get enough people following the rules, I think we can have a successful reopening where we don't go back to locking down or sheltering in place. It's certainly possible. Some areas of the country are going to go through that, but I don't foresee that on a mass nationwide level. I certainly hope not. There's going to be people that disregard it. We know that. But if enough people do, I think we have a good chance of being able to avoid that.
Okay. I'm going to go back to Karen real quick. I want to ask her about ventilators and bed capacity. I don't think we hit that. Karen, how you guys doing on vacancy rate? I'm sure you did say it, but I've been trying to do 10 things at once.
No, actually, I didn't. I forgot. We are at about 80 patients admitted, so we have about a 30% vacancy, 30 to 40%. And ventilators right now today, we are actually fine as well.
So that goes back to what Dr. Frank said earlier.
Yes.
When we
He's-
sheltered in place, we were all told to flatten the curve. And the reason we were flattening the curve is so that we don't overwhelm our healthcare facilities where, Karen and her fellow nurses and her doctors are forced to make life and death decisions based on the availability of ventilators.
Correct.
So we were successful in that regards, right?
Yes. Yep. Yes.
Okay. That's good.
Yes.
The question is how long, now, it's a lot more complicated, but I appreciate that. I think if anybody has anything they want to bring up, please clap or raise your hand, whatever you have to do on Zoom. I know Mark Heitz had something he wanted to bring up. So Mark's the head of the Hammond Park Department. We're going to go ahead and go to him. Hi, Mark. How you doing?
Yeah, all right, Mayor. I just wanted to point out a few things. Karen hinted at it, but there is the opportunity that you locally have the chance to change these rules. These are not set in stone. This is a very fluid situation still, and it's important to remember that I think the governor's putting this in place to allow certain things to start to recover in a certain way. But it's really important to stress, especially like for us in our department, we have a senior center at Pulaski Park. That is the most high risk population there is in the city. That facility probably likely will not reopen until at least the 4th of July. So that there's things like that we're looking at. Our membership of our fitness center at the Civic Center is 75% of our members are 60 plus. That's another one that even though the directive from the governor shows that gyms and fitness centers can reopen, it's just that it's they may reopen, they may not as well, or they may be delayed further. So I think that's something important to show out there. Playgrounds will be slow to open because again, that's the gravy to the community. There's no one it's not a necessity that anyone has to go play on a playground. While we want everyone to go out and have fun, the most important is protecting our public safety at this point. So that's something that we want to reiterate. And I'd also just mentioned, you were rattling off a lot of the things that Mayor or that the governor mentioned last week. The website that the announcement that he made was backontrack.in.gov. I think that's important for everyone that's out there. If they want to see that in a little bit more detail, to check that out. Again, I'll repeat it again. Backontrack.in.gov is something that if people want to look at a little bit more detail, but I think it's important to remember that it's a very fluid situation.
Thank you. Appreciate it, Mark. Mark reminded me, I want to talk about things we can't do. And then I'm going to go to the building department next. Things that aren't happening right now. The YMCA, the Sportsplex, large gyms like that shut down until, is that May 24th? Yeah. May 24th. So as soon as the YMCA could open, Purdue Gym, other gyms you may go to, Atlantis Fitness, May 24th. That's the soonest, assuming things go well. Recreational sports, baseball, softball, soccer, tournaments, nothing. No practices, no games until June 14th. As soonest is June 14th legally. That means Little League's not going to be playing. Cal Ripken's not going to be playing. Any soccer league's not going to be playing till the June 14th at the earliest. That's assuming our testing's going well, our caseload's on the downslope. June 14th at the earliest. If we have any setbacks, not good. Dining rooms aren't open yet, and they won't be open until next week in Porter County, 2 weeks for Lake County. No malls are open. Large venues not open. Casino not open till mid-June at the earliest. So let's see. All right, that's all I got. I want to go to Kelly Kearney, who's the head of the Hammond Inspections Department, to talk about you know, I know construction is still happening across our city. Sometimes inspections need to be done. I want Mr. Kearney to talk a little bit about this procedure, how you interact with us if you need to get these types of things done. Kelly, how you doing?
Thank you, Mayor. You're doing fine. We are still processing construction permits, building permits. It can be done over the phone. You can call the building department at 853-6316. The office help will.
853-6316.
They will walk you through the process of what needs to be done. Inspections can still be done. Call the same number and set up that inspection. Renter registration will be done through United States Postal Service or other means. If you need to call the office, that's 853-6447. 853-6447 for code enforcement. We're trying to do business as usual. It's just a little more complicated under these circumstances. But we still want to do business. We still want you to be able to do your projects. Obviously, Home Depot was pretty busy over the weekend, and it's still going on. We just want to make sure that when you're doing construction project, that's being done safely and correctly. So please apply for those permits at 853-6316.
853-6316 for permits and code enforcement issues, 853-6447.
Correct.
Okay. Okay. Does anybody else have anything they want to add to the meeting? Let's go back to Mark Hines. Hi,
Mayor,
Mark.
hi. I think it was Karen who mentioned at the last meeting as well that we had on here, but I think it was really important. You mentioned in your staff meeting this morning about a lot of local businesses that they've always had the no shirts, no shoes, no service kind of policy or signage. I think a lot of them, as they're implementing mask requirements, I think it's important to know, as the police department reported this morning, that if they're requiring a mask, it's the same type of policy. They can refuse service to you. So I think that that's an important thing to note to the community and all the listeners out there. Also, I know on Facebook, you're getting quite a bit of questions about the leagues. We issue permits through the Parks and Recreation Department. I'll be sending out notices today to all those different leagues that yes, June 14th is the first day as of right now that they might be able to begin. So that would be the beginning of even practicing. So if a coach is telling you differently right now in a Hammond Park, you are not allowed to be practicing anywhere within the city of Hammond limits at that point. So you cannot be doing that. It's whether it's games, practices, tournaments, that's both inside. Obviously that applies to our Sportsplex, Gene Shepherd Center, Civic Center, but also outside, all of our little leagues, all of our soccer programs, any of the rugby program that uses our parks. Those are all leagues that will not be allowed to use and have their programs going until June 14th at the earliest, if we meet and continue on the schedule that the governor has put forth.
If we do.
If.
So going back to what Mark just said. So if you're part of an organized league, Cal Ripken, Little League, soccer, formal programs, the fact is you're probably going to be prevented by the national organization from doing these types of things. What we're really worried about is travel baseball teams, for instance, like my team. My team's not going to practice. We're not going to violate the law, but there's some crazy baseball coaches out there that are going to put the kids on the field, and that cannot happen in the city of Hammond until June 14th, and the Hammond Police Department will be there to assist. It's an easy rule for us. We should see no organized sports anywhere within the city of Hammond until June 14th at the earliest. You can't rent space at the Sportsplex. You can't rent space at the Civic Center. You can't use even just a patch of dirt with organized sports until then. And going back to something Mark said, if the numbers are trending in the right direction, and if the testing is going well, and if we're heading on a downward slope, maybe our leagues will start June 14th. Maybe. If we get a second flare up, there won't be a baseball season. Let's just be honest. So, Karen, you got anything before we knock off?
I just wanted to say that was Dr. Masana. I can't take credit for no shoes, no shirt, no mask, no service. That was him.
But you brought the video, though. Thank you for the video. Dr. Frank never brought us a video, so. Okay. Okay, we got a question from Councilman Scott Rakos in Hammond's Hessville District. Hey, Councilman.
Hello, Mayor. I just wanted to reiterate to Mark, if possible, if we could put the tape around the playground areas. Now it's almost down. I drove around there this morning and it's mostly down. Also, if PD could take an extra ride by those parks, because when it's nice, you know, the kids are out there.
Thank you, Councilman. I saw it myself. You're right. And what we're asking the PD, and Andy, I'm going to put you on in a second, is I think I drove right by a police officer the other day, and there was probably 5 kids playing basketball at MLK Park. And I was going to say something, and I saw a police officer pull up, and I said, oh, okay. I don't have to be the bad guy. I got an officer that could do the job for me. So I drove by, and I watched the officer, and the officer just drove right by it. It didn't stop, didn't say anything, and I almost went insane, I'll be honest with you. But what I'm asking Andy is to make sure that our patrol officers are looking for what Councilman Rakos just said, and even just a blip of your siren, whoop, whoop, you know, or, hey, you guys know you're not supposed to be doing that. Just, we need to make sure that we're communicating, and if they refuse to comply, something's got to be done. So, Andy, what do you think about that?
If you see them out there, call me. Most of you guys have my phone number. If you don't, I will make sure that an officer goes over there and take care of the situation that you're speaking of. But our officers are out there. Like I said, I was out there Saturday, and I used the loudspeaker in my vehicle to tell the guys, hey, back off.
I know you do, but I want to make sure that I don't see what I saw again the other day, because there's only so many assistant chiefs of police and chiefs of police, and there's only so many mayors. We have 14 Hammond police officers constantly patrolling our city. I mean, we shouldn't be the bad guys all the time, Andy. I mean, we have a lot of officers that could do that for us. So
I would take care of that. I would send out another email today.
okay, thank you. Okay, we got a question from Councilman Warple. Hi, Councilman Warple, how you doing? You're muted. Hold on. Hi, Councilman Warple, we can hear you now.
Can you hear me now?
Yes, sir.
How you guys? It's not really a question. Just we ironically have a meeting on next Monday when we go into phase 2. So at this point, we had planned on still doing it all electronically. We'll have to look into whether or not one of us has to be there at the council, because the public will be, I think you said 25 invited, but we'll make that notice available as soon as we find out.
Okay, hold on. I got corporate counsel coming up to deal with this issue. Thank you, Councilman Warple. Hammond Corporate Counsel, Kevin Smith. How you doing, Kev?
Good morning, Mayor.
Councilman Warple brings up an interesting question, Kev. It's when we go to phase 2, can we have all Zoom meetings?
The governor has allowed cities and towns and counties to decide on their own as they believe it's appropriate to do what they want regarding their government meetings. He has not given any specific directive regarding whether or not meetings should become in person again. And given that the state is not even going to really open their buildings until around September 18th for limited, I would think Councilman Warple and any other folks like Mark Hines that has to deal with boards that are on the call should be concerned at all about doing Zoom meetings only until further directions received from the state. So my recommendation would be, if you're comfortable with Zoom and there's essential business being done at those meetings, you can still do it by Zoom without the governor giving other direction. Thanks, Mayor.
Thank you.
Thanks, Dave. Thanks, Dave.
Thank you.
Yep. Any other questions? Dr. Frank, you got anything else you want to bring up before we knock off?
No, sir.
Okay, I appreciate everybody's participation. A lot of Hammond residents are getting their information from this meeting. I think it's way better for all of us to speak the way we did than to summarize after the meeting's over. Again, to Brittany, I want to say thank you for interpreting for us. And I want to thank everybody for being a part of this. Our next meeting is Thursday at 10:30. Thank you all. I'll see you then.